Well, greetings, everyone. Today I'm talking with a dear friend of mine, Dr. Bob Bertolino. Bob is the professor of rehabilitational counseling at Maryville University in St. Louis. He's the co-author of over 14 books and senior clinical advisor for a nonprofit organization known as Youth in Need. And in my opinion, he's an expert in a wide variety of areas of psychotherapy. And it's great to chat with him today. Hi, Bob.
Hi, good to see you, Paul.
Oh, always a pleasure. Before we get along in this interview, I also want to mention that Bob is also a musician and his band has a new album out. Can you tell me just a minute about that?
Yeah, I put myself through school actually playing in clubs for years and recording, and then took a hiatus from that to finish school and get my life going, kids raised and all that. So I stepped back into it with a project we put together. The name of the band is Another Mystery. We released an album. It's on the major platforms and it's on CDs, available on CD. And that came out in late November. We're now ramping up and playing live shows and working on a new album. So it's been a nice reprieve and good to talk to a fellow musician. So a reprieve from everyday work,
right?
Different kind of work, but very enjoyable.
So, and it's anothermystery.com, right?
Anothermystery.com. Yes.
Yeah. I've heard a lot of the tracks, and they're excellent. The production values are great. So I just wanted to let people out there who are music fans know that you have an alter ego. That's the frustrated musician toiling away, writing and being creative, which is good therapy, man. So
yeah,
that's great.
Thank you.
Well, I want to talk a little bit today about, as we were discussing before we hit record, about this idea of positivity and wellness. And in psychotherapy, it's been such an interesting ride when we look at the history of our field, to where, as you and Bill O'Hanlon talked about, 3 waves of therapy, where the first wave it's more past oriented and pathology focused, and then the second wave is more present oriented and pathology focused, and then the third wave we're getting into more a focus on client strengths and resources and being more future oriented. There's been a lot of research over the last decade or two of the field of positive psychology. I know you're one of the researchers and authors who've written about that. Where do you see this idea of wellness and positive psychology bridging into psychotherapy? Because in many ways, this isn't really new in some fields, but it's like we've forgotten, I think, how important that aspect is to treatment.
Yeah. There's a lot in that sort of statement that you just made to really touch on, and I'll be brief. But I do think history, as many people know, based on their training or their own study on the side or through workshops, whatever it may be, that, we can go back decades to Maslow and Rogers and a lot of the existentialists and humanists who really looked at the capacity of human beings to not just adapt, but to live these full lives. Right. That, we always steered away from the word happy, right? As psychotherapists, but truly happiness being a subjective experience, but there is something called happiness. And they didn't use that term so much as they just looked at the capacity of people. And of course, Erickson's work in a different realm, but also this capability that people had within themselves to not only self-heal, but also, I think, to be able to handle things that, are field with a focus, as you mentioned, the waves on first pathology and then problems and then resources, was going through its own incarnation of this. And so I think what happened is that we got to a point where the models were so much of a focus, and the models said, focus on this, go and focus on the pathology, find out what's wrong, find out a remedy for it. Or if you're more on the CBT side of things, or you're, taking more of a problem-focused approach, which most of the early family therapy approaches had, then again, what's the hypothesis? We have to do some change in thinking. We have to do change in interactions if you're a family therapist. Still very much hanging to this idea that you've got to do something as a therapist and you've got to initiate the change. And I don't think anybody would deny that a therapist is an important part of the process, but we don't make people change. We are facilitators of change. And so motivation is an intrinsic kind of thing. Once we moved in sort of the third wave, which was the, ushered in these solution-based models, narrative therapy, collaborative language systems from Houston, Galveston area. And then, of course, we still had Erickson sitting there, and we had reflecting teams. We started to get this movement back to what I thought was more promising and felt better as a therapist and excited me. As you and I were talking beforehand, Paul, just about, sort of the years of feeling really good about what was happening in our field. And that provided a lot of fuel for me. Well, on the heels of that, as we started to get some research that came really out of the common factors, which I know there are plenty of issues around that, but just saying, hey, clients are the engineers of change. You've got to form good relationships. You've got to have the sense of hope and expectancy, not just that you believe yourself as a therapist, but your clients have this sense of hope that I think you can help me. And knowing that our models are facilitators for that. They're not the reason people change, but we do need to know our models, and we do have to have ways of interacting with people and intervening. But I thought the research started to give us more of the pavement, the foundation that we needed. Otherwise, we were just talking about another model that somebody made up. Mm-hmm. So the research was starting to catch up. Well, at the same time, we have this whole entire different realm, mostly in the field of just traditional psychology, through Martin Seligman, Mihaly Csikszentmihalyi, and Sonia Lior-Bomersky, all of these folks who started studying well-being. But they were doing it through online surveys, and they were, sort of studying, what are the effects of maybe shifting your worldview and trying these exercises to see if we can take your baseline and hopefully have an upward trajectory. And then that way you will have more enjoyment in life, which is the sort of antithesis of depression and anxiety. So you start to feel better about your life, and then you accept that things are going to happen, and you go, I don't like that, but I can deal with it. Mm-hmm. But it was mostly in psychology. And then there has been, in the last few years, I think, movement towards melding the two. Psychology research, psychotherapy. And at Bill O'Hanlon, I wrote a book a few years ago, The Therapist's Notebook, on positive psychology, trying to make that connection. And I think since others have done the same thing. So I feel really good about where we're heading. It took the research to catch up, and it has. So now I think we're in a really good place.
Yeah, I'm kind of feeling that there's a door that has been opened. I just feel like it's a trickle that's, and then it's like the faucet gets turned on a little more and a little more, and more practitioners tend to follow that. For like last, was it the 2010, they called it the decade of the brain in our field. And now we're in 20 years where it's still a lot of focus on trauma and the brain and those kind of things. And I found that this perspective that we're talking about is a great counterbalance to these type of neuroscience focus therapies that tend to, a lot of in our field is focused on the trauma, but the neuroscience about how we actually feel good, certain things that we need to do, actions we need to take that empirically shows that people's brains change for the better. And I'm hoping, as I'm seeing, a little bit of that melding of those. Now, a concern that I have, and I'd like to get your kind of take on this, is with all the door open and the changes, I'm finding a lot of times that newer graduates, I know you're also a professor teaching therapy and those things to people going in the field. There doesn't seem to be, from what I'm seeing, as much good grounding in understanding the people who and the ideas that made this change possible to open the door. So I'm wondering, what is your opinion, kind of the state of therapist training about these older ideas and older models that we see now popping back up and sometimes get relabeled as if they're the brand new thing. But, if we know anything, we know they've been around for a while.
I'm glad you brought that up. I think that's a very important topic. It's an important topic to me. I'm not going to speak for anybody else, but our ancestors in the history of psychotherapy, there's an edited book with, gosh, I'm sorry, I'm blanking on the editors, but The History of Psychotherapy. And it's a wonderful book. And when I went through it, and it's dense, so I will just caution people, but just the early part about how psychotherapy actually had traction in the US. Everybody thinks it was mostly Europe with Freud and Jung and Adler and so on, but there was a movement in America at the same time. And so which I think is interesting because a lot of again, I didn't know that so much and I learned a lot from that, but we now in 2021, and I think for the last short while have looked at psychotherapy as starting in like 2000. That's the way it's taught in a lot of classes. No, not, like saying there was no history, just nobody talks about it. Right. And I think our forebears, our ancestors that, well, again, you can go back to Freud or you can even, just take some gaps in between. I think the waves help. That's one of the reasons Bill O'Hanlon and I talk about it is the waves sort of tell you which different theorists at different time made contributions. But and my feeling is we need to be talking about the early contributors and what they thought, because everything that we have done since the early 1900s, some would argue the late 1800s, is standing on the shoulders of these people who made amazing contributions. It's easy to be critical because in our decade or our era, of course, you can look back and say, why were they? Well, everybody had to start somewhere. Right. And they had to generate ideas that could even be debated. Mm-hmm. And there's no way that Freud is saying the same thing in 2021 that he was saying in 1895. It's just not going to happen. So I think what concerns me is that we're not talking about the contributions of some of those folks. We jump straight forward to the latest, greatest model. And if I were a student, I would think, oh, well, I guess, psychotherapy started with DBT or ACT or something. And there's nothing, I'm not picking on those models. I'm just saying that the history that led to the development of those models is critically important. Mm-hmm. And so I would just hope, and this is what I try and do in my classes, is whenever we talk about a model, we go through the history. We talk about who are these people and what was happening at their time. Mm-hmm. And, and then the progression of the model, what it looks like today as it's practiced. So maybe I'm just being old school in that, but I really, I would like to see more of a focus on at least acknowledging those contributors and then seeing where the model has been taken today.
Mm-hmm. Mm-hmm. I'm the same way because I think there's unfortunately so many ideas that laid the foundation that what I'm seeing is some people, even if they've heard about it, it's like there's not a clear fundamental understanding. So for example, the idea of a paradoxical intervention, we hear about a lot of coming out of the family therapy field and went further back with Viktor Frankl and all that. Those kind of are looked as novelties instead of having a good understanding of there's an actual systemic process of interaction with your client to create those kind of sometimes amazing transformations using those ideas, but it tends to be glossed over, moving on to, as you say, the more modern therapies. And a lot of the modern therapies, and again, this is just my opinion, is I'm seeing it's really based on other things that are relabeled, and someone has a different perspective and they change it. And I mean, it's I think 500 different types of psychotherapy in the world. And obviously our textbooks would be so huge if we had to cover all of them. But it's kind of like that sports analogy that if you don't have that fundamental grounding of how to dribble and run with the ball and guard, you can't really play basketball very well. And I think sometimes, particularly graduate students coming in, are already thinking about the slam dunk. And it's like, no, we got to dribble the ball. We've got to, keep the guard up and move. As a practitioner and as a professor, training new clients, how do you kind of bridge that gap between the old and the new?
Well, so I find I'm thankful for this. The students of today are very they're flexible for the most part, and even the students that come in thinking one way, what I consider, these are their life experiences. It's always an invitation to a conversation, is to be introspective about where did you come up with this idea, how does it work for you, what challenges have you met, and say, rather than I'm going to say there's a right and a wrong way, I'm saying, let's see if we can understand different ways, and let's see if we can find ways that are more effective. And so it's a conversation that I think there's a parallel. They use the word isomorphism in family therapy, but there's a parallel process with training students and doing supervision as there is with clients. Mm-hmm. You go in guns blazing and confronting people, you're not going to get very far, but you invite them into a conversation where, back to Rogers, unconditional positive regard, you accept who they are and that they have these ideas. You don't have to agree with their ideas. And I think the delicacy and the skill that go together with, John Norcross, if you look at his books on the psychotherapy relationships at work, now 2 volumes, we have 1,100 studies on the therapeutic relationship. We need 0 more studies. Right. It is well established. Well, it's not really different in our personal lives. It's not different with our students. It's how we go about it might look a little different. Mm-hmm. You don't have the same conversations with your partner that you do with your students, but there's a parallel about what you're trying to accomplish. So I sort of think of trying to sort of get into that space of the conversation and open it up in such a way that they can start looking at things in a way that, again, opens them up to new possibilities with their clients. And so the basics that you're talking about, they've never gone away. I think we got so infatuated with models, though, that students would even say, just tell me how to do it. So your example of paradox is a perfect example. Somebody would say, well, I just want to know how to do a paradox. Well, use the word process, which is very important. It's a process. Mm-hmm. It wasn't just like, okay, here's the paradox. If you look at how it was done in strategic family therapy back in the Haley and Madonna's days, or it was well thought out, or how Erickson did it. And they didn't go in and say, okay, we're going to do a paradox. It was part of the developed intervention.
Right.
And sorry, I think I might have a little delay here.
You're good.
Sometimes it worked and sometimes it didn't. And if it didn't, they rethought it. And they only used it under certain circumstances. So the understanding of how they used it was critically important. Mm-hmm. And so, I think that process still rules here. And if we don't have the fundamentals, then there is not going to be the foundation for any of these sophisticated methods or whatever to work.
Right. Yeah. And as you're saying that, I just registered in my head when I have taught basic psych 101. And I find that, there's a chapter on the psychotherapies, I'm teaching undergrad students for that course. It's amazing how many of them naturally click with, one of the therapies, even though none of them are, well, I should all of them are ever going to be psychotherapists. But it's phenomenal to me how many of them actually connect with Freud, some of Freud's ideas. And it just kind of jumps out at me because for years I was like, Freud, are you serious? Oh my God, Sarah, God, here comes the phallic stage. And,
yeah.
But there's so much wisdom outside of all those details that, as you said, the context and the time, that we're still really talking about a lot of the same stuff Freud was talking about, but his perspective was different. Like we're talking about the decade of the brain. How much of this is about unconscious processing and early childhood trauma and how that manifests in these, it's the inability to at least be knowledgeable or to appreciate that foundation, I think actually hampers us as a field.
Yeah. And the things that last from Freud that are part of our nomenclature, defense mechanisms, we still use the word ego. And I think it's a fair argument, whether you call it the ego or not, that we are trying to strengthen who people are through our therapeutic processes. So they, not as a convincing, hey, you can do this, just stare in the mirror and repeat these, different kind of, self-talk things. It's more about saying there's something within you. And I know this from your history that got you here today, that's helped you to deal with challenges in the past. And I'm interested in that part. And we're going to add to it. But I'm interested in that part of you that has been silenced or you've had some amnesia to, because what you're facing now is so difficult. And so it's that, I think we don't have to call it ego, but that's really what it is. We're strengthening the ego, which was the core of Freud's approach. So there are these lasting things. I completely agree with you. And again, Freud would articulate them completely different than he would now. And they didn't have, MRI scans, and they didn't have all these things. But doesn't it make sense? And haven't we all seen this? And maybe in our own lives, something happens and we protect ourselves from it?
Yeah.
Yes, absolutely.
I have a friend who's a philosopher and a mystic, lives in Sweden. He's Irish. He lives in Sweden. His name's James Tunney, and he's concerned about psychotherapy is that we will drift off from being more interested in people's neurons and more interested in all these other ideas that we have, forgetting that there is an aspect of personal sovereignty of each individual. And I find that that's probably a very realistic concern from someone who, he's not a therapist, but someone on the outside looking in. So it's really holding on to that humanity of people primary. And it's very often, I think, and I was guilty of this when I started, is that focus on the techniques and all, forgetting that like you said, the creating the ego strength, those things. How did you train yourself? I know we're going back a ways, but how did you train yourself to move away from that grasping on the technique and to say, okay, let's first go with that humanity of the client?
I connected with people who I didn't know well at the time, but I felt were more like-minded. I actually wasn't finding that in the early 90s in the people that I was around. I mean, that I lived close to. I had to seek it elsewhere, and I wrote letters. Remember when we used to write?
Yes.
Well, I typed them, but I mailed them. And I to a whole bunch of people, and I got one reply, and it was from Bill O'Hanlon. And the reason is I came across his name in a textbook. And honestly, I don't even remember how I found him, but eventually, and I went to some workshops and then began studying with Bill and studying with Steve Gilligan. And a theme across all of this was, even though there were these sophisticated ways that were beyond me at that point of how to intervene, and process-wise were sometimes different than what I learned in grad school, what was there is the humanity and the perspective, a philosophical perspective, which I later and other people have called strength-based. But I got to a point where I realized something that became crystal clear, and has happened in my 30 years with my work at Youth in Need. It's happened with students, happens with my clients, anybody I supervise for their license, is you can teach method and technique very easily. It's not difficult to ask certain kinds of questions or set up different interventions. However, if the philosophy about people is not one of seeing people as capable of changing and seeing, people trying to make their best attempts to try and deal with life as it is right now, rather than manipulating us or showing defiance or being oppositional. And I'm not saying that clients don't push back. I'm saying that I think there's a good rationale as to why they're acting the way they are. And I, like anybody else, is going to say, yeah, that's a problem if you continue to do that, or it already is a problem. But the pathway in is, to me, I call it personal philosophy. Some people call it worldview. But for me, I aligned with people whose worldviews were more consistent with mine. I'm stepping into this other person's life temporarily, or maybe a little longer term. And I've got to, take the perspective. If I was going to play them in a film, what do I need to know about them? I didn't invent that. Somebody else did. But that this person and who they are has nothing to do with theory, zero. But what it does is it creates this foundation of being able to connect with people so that the methods then work. So how I aligned with people is what I did. And I was very fortunate. And then I started to understand where I differed with other people. And I won't get into it, probably a whole different conversation, but I had a very in-depth conversation out in Amsterdam years ago with some people who had a slightly different view than I did. And they said philosophy was irrelevant. It's pragmatic psychotherapy. You do this, then you do this, then you do this. And we never found sort of an agreement about it. But that's where our field is some people are pragmatic. Just ask the question, do this intervention, and it should work, hopefully. It never has worked that way, but that's the belief. And I, that's what